So, hey guys, we're back again. In this video, we're going to be covering the evolution of medicine part 2, which is the 20th century to the 21st century. Okay, in the early 1900s, the primary treatment for neurotic mental disorders and sometimes psychosis is psychoanalytical therapies, which are known as talking cures. This is developed by Sigmund Freud and others, such as Carl Jung. In 1914, thyroid and rabies vaccines are first licensed in the United States. Tetanus toxoid is introduced. In 1915, the persistus vaccine is licensed. In 1918, the Spanish flu influenza pandemic is responsible for taking 25 million to 50 million deaths worldwide. That's including more than 500,000 in the United States. In 1919, a chemical in the mustard gas used during World War I is found to reduce the white blood cell count. This is now known as chemotherapy, which is safe, by the way. In 1922, insulin is used for the first time in the treatment of diabetes. This is allowing diabetics to survive longer after the diagnosis. In 1928, antibiotics dramatically decrease the risk of post-surgical infections. In 1928, also, drugs, electroconvulsive therapy, and surgery are used to treat people with schizophrenia and others with persistent mental illness. Some are infected with malaria, others are treated with repeated insulin-induced comas, and others have parts of their brain removed through lobotomies. This is a very sad era for the psychology chapter. In 1937, the first blood bank opens. This helps make more surgery possible through treating. In 1937, the first blood bank opens, helping make more surgery possible by treating bleeding that happens during the procedure. In 1943, during World War II, penicillin becomes more mass-produced. It was known as the miracle antibiotic at that time. In 1946, President Harry Truman signs the National Mental Health Act, calling for National Institutes of Mental Health to conduct research into the brain and behavior and try and reduce mental illness. In 1947, chemotherapy records its first, though temporarily, success with the remission of a pediatric leukemia patient. In 1949, Australian psychiatrist J.F.J. Clade introduces the use of lithium to treat psychosis. Lithium gains wide uses in the mid-1960s to treat those with manic depression. This is now known as bipolar disorder and is still used to this day. In 1950, John Hopkins invents the cardiac pacemaker. In 1950, findings related to DNA give rise to a subsection of biology known as molecular biology. Also in 1950, a series of successful antipsychotic drugs are introduced that do not cure psychosis but do help control its symptoms. The first of the antipsychotics, the major class of drug used to treat psychosis, is discovered in France in 1952, and its name is chlorpromazepam, also known as thorazine. Studies show that 70% of patients with schizophrenia clearly improved on these antipsychotic drugs. A new type of therapy is also born, behavioral therapy, that suggests that people with phobias can be trained to overcome them. In 1953, a heart-lung bypass machine is used successfully for the first time during surgery. In 1955, the first polio vaccine is licensed, pioneered by Dr. Jones Salk. The Polio Vaccination Assistance Act is enacted by Congress. The first federal involvement in immunization activities. This is because polio was killing a lot of children, and it really needed to be stopped. In 1957, William Gray Walter invents the brain EEG topography, which is also known as a toposcope. In the mid-1960s, many seriously mentally ill people are removed from institutions. In the United States, they are directed towards local mental health homes and facilities. Now, while the number of institutionalized mentally ill people in the United States will drop from a peak of 560,000 to just over 130,000 in 1980, many people suffering from mental illness become homeless because of inadequate housing or fallout care. In 1964, a U.S. Surgeon General's report establishes an undeniable link between smoking and lung cancer. In 1966, the Center for Disease Control and Prevention announces that its first national measles eradication campaign is in occurrence. Within 2 years, measles incidence decreased more than 90% compared to its pre-vaccination era levels. In 1967, a heart transplant is performed by South African physician Christian Barnard. The heart recipient survived 18 days until succumbing to pneumonia. This is actually a really big step in the transplant of organs because it's the first time an organ had ever been transplanted into a person successfully, even if it was only for 18 days. The fact that he actually lived after surgery is a big step for medicine at this point. In 1971, President Richard Nixon signs the National Cancer Act. In 1972, the development of computer tomograph I can't pronounce that word. It's a CT scan. Revolutionizes radiology. In 1973, Dr. Jeanette Rowley shows chromosome abnormalities in those in cancer, or those with cancer. In 1978, a baby conceived via in vitro fertilization is born. This is the first human baby to be born from in vitro fertilization in the world. In 1980, an estimation of 1/3 of all homeless people are considered seriously mentally ill, the vast majority of them suffering from schizophrenia. This, unfortunately, leads to stigma that is still occurring to this day. In 1981, the FDA approves the first vaccine against hepatitis B. This is one of the primary causes of liver cancer. In 1982, the Javac 7 artificial heart is used for the first time. In 1985, the first documented robotic surgery is ever performed. In 1986, Prozac is developed to treat various mental illness. In the early 1990s, we're not going back in time, for the first time, overall cancer rates began to fall. A new generation of antipsychotic drugs is also introduced. These drugs provide to be more effective in treating schizophrenia and have fewer side effects. In 1994, the entire Western Hemisphere is certified as polio-free by the World Health Organization. In 2001, the FDA approves Gleevec, the first drug to target a specific gene mutation. In 2003, the sequence of the Human Genome Project is published. In 2006, a vaccine is developed to prevent cervical cancer due to the human papillomavirus. In 2009, the vaccine court rules that mumps, measles, and rubella vaccine, when administered with the thimerosal containing mercury, which is ethyl mercury, not methyl mercury. Ethyl mercury is actually alright for your body. You can pass it through your body very easily because it doesn't bind to any of the proteins or fats or anything in your body. Administered with thermal-containing vaccines does not cause autism. In 2014, Canada made a great leap in the discovery of a cure for Ebola. This cure came out of Winnipeg and was used to treat doctors, nurses, and many patients in Africa. That's the end of our Evolution of Medicine videos, and I hope you enjoyed. So, I'm going to leave you with that, and good night. Have a nice night.